Kate, we just get on. All right, everyone, we're gonna start out with a song. Some of you might have this song sheet, but you can also just follow along. There's a middle part of each verse we're singing where it's sort of call and response will sort of indicate as such. Well, I might not, but hopefully some of the other ones will because I have a baby, ma'am. There are mean things happening in this land. There are mean things happening in this land. But the movement's going on, and the movement's growing strong. But the movement's going on, and the movement's growing strong. There are mean things happening in this land. There are mean things happening in this land. There are mean things happening in this land. Tens of millions uninsured, and those who are pay more and more. Tens of millions uninsured, and those who are pay more and more. And there are mean things happening in this land. There are mean things happening in this land. There are mean things happening in this land. Trillions spent on endless war, but we cannot house the poor. Trillions spent on endless war, but we cannot house the poor. There are mean things happening in this land. There are mean things happening in this land. There are mean things happening in this land. To serve the Wall Street bottom line, our health and bodies in decline. To serve the Wall Street bottom line, our health and bodies in decline. There are mean things happening in this land. There'll be mean things happening in this land. There are mean things happening in this land. Healthcare is a human right, and we won't give up the fight. Healthcare is a human right, and we won't give up the fight. There are mean things happening in this land. There'll be good things. There'll be good things happening in this land. There'll be good things happening in this land. When the people take a stand and unite in a solid band. When the people take a stand and unite in a solid band, there'll be good things happening in this land.
Hey everyone. Today we're starting the day by bringing in the voice of Tammy Menard. Tammy and her partner Troll passed away in their tent in November. This was a devastating loss for their families and for our community. We're sharing the words that she spoke in front of the State House, this very building, in 2021 to ground ourselves in the power that Tammy, a leader in her community, shared with us that day, and the truth in her words.
Sorry. Why is it not playing?
Doesn't work, I can read it.
It's not playing. Want to read it? Yeah.
Tammy said to us, across all these stories, the need for dignity and respect stands out most. Housing and healthcare are human rights, and until we live in a country where everyone is housed, fed, and folks have access to health care, we have the responsibility to treat everyone with dignity and to continue to organize and fight for a system that provides those basic needs.
Let's try that one more again, in her own words.
Across all these stories, the need for dignity and respect stands out the most. Housing and healthcare are human rights. Yes. And until we build this country where everyone is housed, fed, and folks have access to healthcare, we have the responsibility to treat everyone with dignity and to continue to organize and fight for a system that provides these basic needs. Yes.
People in our state are suffering and even dying from lack of access to health care and housing. Today, on Martin Luther King Jr.'s birthday, we'll hear from community members impacted by these human rights crises. Today, we say to Governor Scott and legislative leaders, we need a public hearing on health care. And we need a state of emergency declared on housing and homelessness. Grab a yellow flyer with more information on it about what we're calling for. We're here, we're united, and we are organizing. We are the working class, part of 140 million people in the United States who are poor or one emergency away from poverty. And we won't be silent anymore. So I'm Kate Candlestein. I'm an organizer with the Vermont Workers Center and the Nonviolent Medicaid Army. And this is Mads Walker, also an organizer with the Workers Center and NVMA. And we are going to introduce our speakers in a moment. We'd like to ask that everyone speak slowly for interpretation and to join us after this rally in the cafeteria for lunch, which was brought by the People's Kitchen. And if you're tuning in from home, via the live stream, we invite you to share your stories in the comments as well. And if anyone needs support of any kind throughout our event today, Amy and Denise have red armbands and you can find them.
I can take the time.
Awesome. All right, I'd like to invite our first group of speakers up. We'll have two groups of speakers today. First, I'd like to invite Ellen Schwartz from the Healthcare is a Human Right campaign, Dee Graham from Planned Parenthood Northern New England United, Enrique Balcazar from Migrant Just Justicia Migrante, Deb Snell, the president of Vermont Federation of Nurses and Health Professionals, Jacob Berkowitz, the vice president for communications of UVMMC Support Staff United, and Quinn and Ronnie, who will be reading a statement from the National Union of the Homeless. All right.
Go ahead.
Hi, my name is Ellen Schwartz. I am from Brattleboro. I use she, her pronouns, and I'm a member of the Vermont Workers Center. Windham County has been hit hard by the recent closure of the Bellows Falls Health Center. In addition, the recommended cuts at Grace Cottage and Springfield hospitals will, if carried out, impose longer travel times on patients in an area with scarce to no public transportation. This fall, the Workers Center hosted meetings and canvassed in the West River Valley and Bellows Falls. In our conversations, transportation was named by person after person as a huge barrier. Rose of Bellows Falls explained that she doesn't qualify for a Medicaid ride because she owns a car, which is considered access to transportation even though she doesn't drive. And Marianne of South Londonderry was dismayed to learn that her two nearest hospitals were both recommended for restructuring. As an older person with a physical disability, she worries about how she will get to more distant hospitals if these cuts go through. Transportation isn't the only issue we heard about. Catherine of West Rupert summed up what we heard from many people when she said, I have health care technically, but it covers so little and it costs so much that I don't use it. Closer to home for me personally, my adult grandson needs a root canal later this week, and it costs more than his Medicaid benefit covers, so he's putting it on a payment plan and crossing his fingers that he finds work soon. The cuts to hospitals and health centers are driven by bottom lines, not health needs. The Oliver Wyman report, released in September, failed to get to the root of the problem, but it did have several positive recommendations, such as increasing access to primary care and solving Vermont's housing crisis. But what we're seeing instead is the closure of primary care centers and evictions from emergency housing. Additionally, funding for community-based services for people with disabilities has languished for years, while Vermont funnels $40,000 a year to private equity-based WellPath for so-called care for incarcerated people, in spite of a track record that would get them shut down if the patients involved weren't in prison. But even a more robust system of primary care would do little for the uninsured or underinsured. That's why we need a universal public system to address Vermont's healthcare crisis. Since 2014, when Vermont bailed on its commitment to a universal system, the state has thrown money at programs that promised to solve the problem but didn't deliver. As of 2021, we had spent nearly $30 million to One Care Vermont with its abysmal record of neither reducing costs nor improving quality. Just last year, Vermont spent $1,050,000 on the Oliver Wyman study. In contrast, the Universal Health Care Plan released in 2014 projected savings of $378 million over the first 5 years and a net increase in income for the bottom 93% of Vermont residents. Ask yourself, what have we gained over these 10 years as costs have risen for individuals and families and public monies have gone instead to failed programs and studies?
Hi, my name is Dee. I use they, them pronouns. I'm a proud union member of PPNNE United and a healthcare worker at Planned Parenthood. I've worked in my clinic for 3 years and unfortunately bear witness to our failing healthcare and housing systems regularly. We see policy violence perpetrated by private insurance companies every day, such as repeated ongoing failures to the trans community, unjustly denying access to medications and gender-affirming procedures, as well as general reproductive care, denials for procedures and medications like birth control and PrEP. With the upcoming administration and reproductive and gender-affirming care under attack, all of our patients and everyone in our communities need access to safe and reliable care. The connections between housing and healthcare are also apparent in our work, of course. We hear from many, many patients who are experiencing housing insecurity, and many of my fellow union members also face housing insecurity, working multiple jobs, struggling to pay rent, insurance, groceries, and childcare. Our patients who are unhoused regularly report barriers to reproductive and gender-affirming care, and primary care in general, which is extremely dangerous and places higher burdens on our clinics. And if folks can access our care through funding, referring out to other resources like housing is still tough and often feels futile, like a never-ending game of whack-a-mole of finite resources and dead ends. The funding we do receive has enormous benefits for our patients. We need more of these resources for healthcare and housing specifically, and we need this money for those resources specifically staying in our communities and not going to fund genocides and wars. What we don't need is more closures of health centers. We are all acutely aware of how this will put more lives at stake and again place more burden on our already heavily burdened hospitals and clinics statewide. We saw the material ramifications of clinic closures at Planned Parenthood a couple years ago, which greatly reduced access to basic needs and also upended the lives of many of our workers. Patients, largely in rural areas, report struggling to get time off work or find childcare to get to very much needed appointments that before the closures wouldn't have required as much time to travel. As PPNNE United members, all we want to do is take care of our communities and each other the best we can and to strive for true reproductive justice. We're working hard to organize our working class power to reach our goals. Our communities cannot continue to endure these injustices, and it's past time our government takes sincere action to reach these material needs. I'm honored to be united with everybody here today in our fight for healthcare, housing, and human rights, and we won't stop. Solidarity forever. Thank you.
Hola a todos. Mi nombre es Enrique Balcázar. Hoy estoy hablando en nombre de la comunidad migrante y mis pronombres es él.
So I'm going to be interpreting from Enrique's Spanish into English. And Enrique says, hello, everyone. How are you doing? My name is Enrique Balcazar. I use he and him pronouns, and I'm speaking today on behalf of the migrant community in Vermont.
Diferentes comunidades alrededor del país se enfrentan el reto de la crisis de vivienda. Estamos enfrentando el sueldo más alto de vivienda en la historia del país. La clase obrera y trabajadora enfrentamos retos de sueldos bajos que nos hacen imposible pagar una renta y también las exclusiones que existen y discriminaciones que existen en el sistema de vivienda.
Different communities around the country are facing the housing crisis. And we're living in a time where the ruling class is getting richer and the working class is struggling even more on our low salaries and to pay for housing and other things, as well as facing things like discrimination.
En el estado de Vermont no es la excepción. Este problema se hace sentir a través de las diferentes comunidades, las comunidades pobres, la gente de color, la clase obrera, las comunidades LGBTQ+, y la comunidad de mujeres, también la comunidad inmigrante y muchos más.
And the state of Vermont is no different. Here, different communities are facing these challenges. The working class, poor people, the LGBTQ plus community, women, people of color, and the migrant community.
En los últimos años, la industria de Vermont ha crecido y requieren más y más de la mano de obra inmigrante que históricamente hemos laborado aquí en el estado en la industria lechera. Hasta hace poco, nuestra comunidad empezó a transicionar de la industria lechera a llenar los espacios en diferentes industrias como los restaurantes, la hotelería, limpieza de casas y construcción.
In the last several years in Vermont, we're seeing the industries growing and the need for workers growing. And so where migrant workers used to be primarily in dairy farms, we're seeing that change where migrant workers are moving into restaurant work, cleaning jobs, and a lot of construction work.
Pero es ahora con esa transición que estamos viendo los retos de vivienda, la discriminación por vivienda, cuando se nos pide, por ejemplo, un seguro social al cual muchos no tenemos acceso y muchas veces no nos rentan las viviendas por este seguro.
And so now with that transition away from farms to working in different industries, my community is seeing more and more issues with discrimination around housing access. When we apply to rent housing, we're asked for social security numbers, and many times when people can't provide a social security number, they're denied the housing.
Mucha gente al no poder rentar se ve obligada a regresar a los ranchos y volver a condiciones y abusos a veces donde hemos salido que abusan de nuestros derechos. Aquellos que logran conseguir una renta tienen que entrar en acuerdos que no nos favorecen. Muchas veces cuando rentamos tenemos que usar gente que nos preste su nombre, su seguro social para poder entrar a un acuerdo o muchas veces aceptar acuerdos que no estamos de acuerdo.
And so the difficulty that we're facing in being able to find rental housing pushes many people back to difficult conditions and abuses at the workplace on dairy farms. And then for those of us who are able to find ways to rent, we end up in really difficult situations where many of us are ending up doing things like having to use someone else's social security number to rent, or entering into rental agreements, where we're facing situations that are really difficult and unfair.
Mucha gente que no puede conseguir renta tiene que dormir en la calle, en albergues, en su carro. Entonces, esto es una práctica, sí, lo del seguro es una práctica muy injusta porque deben de haber alternativas que podemos mostrar nuestra identidad cuando podemos pagar una renta, ¿no? Como la licencia de conducir, nuestros pasaportes o otras identificaciones.
And so many people not being able to find housing are forced to be sleeping outside, staying in cars, staying in shelters. And this is a really unfair situation. We need to find alternative ways to be able to rent when we can pay the rent. And we want to be in a rental housing. We need to be able to find other ways to verify with like a license or a passport.
Esto es algo injusto, ya que las manos de nuestra comunidad son las mismas que laboran día a día para construir grandes casas, edificios y hoteles que ustedes miran. Y mientras estas empresas se hacen ricas y ricas generando millones de dólares, nuestra comunidad ve imposible acceder a una de estas viviendas que con nuestras manos estamos construyendo.
And it's a really unfair situation because it's really our labor, our hands, that in many times are actually building these buildings, these large houses, hotels, and those companies are benefiting and getting rich while we're facing this crisis with housing.
Es por eso que exigimos a los legisladores que tomen acción, que nos protejan, que los dueños de casa no pidan el seguro social, que miren a otras alternativas. Y esto no va a terminar la crisis de acceso a la vivienda, porque los precios altos y otros retos van a seguir, pero por lo menos va a ser un pasito más para proteger, por ejemplo, nuestro estatus migratorio.
And so that's why we're asking the state of Vermont to pass a law for landlords to stop requiring Social Security numbers in rental applications. And we know that that won't end the larger housing crisis, but it will be an important step forward in protecting our rights.
Muchas gracias.
Thank you.
Good afternoon. My name is Deb Snell. I'm president of the Nurses and Techs at the UVM Medical Center. I'm a nurse in the medical ICU. I've been there for 25 years. I've seen a lot. And I always think I'm going to come to these type of events and know what I'm going to say. And then I hear these stories, and I am just angry. I am angry that it's 2025 and we're still having to have these conversations. This is crazy. We live in the most liberal state in the country, and we cannot provide primary care or housing or food for our citizens. This is, we should be embarrassed. We should be embarrassed by this. And I'm like watching all these people like cut through, nothing personal, sir, and it's just like, stop and listen to what we're saying. This might impact the rest of your day. This is important. This is so important. Vermont is one of the most expensive states in the country for care. For hospitalizations and outpatient care, we rank in the top 5 as the most expensive. Why? Why aren't we doing something about this? I see patients come into my unit all the time, coming in with a hypertensive crisis, having a stroke. If they had been able to get primary care, a doctor would have caught, you have high blood pressure, let's get you on medication so this doesn't happen to you. Instead, it happens all the time, and it needs to stop. It needs to stop. People deserve to be able to see a doctor, a specialist, and not have to wait 8-9 months to get an appointment. There was a a study that was published in Forbes that showed U.S. adults who regularly see a primary care physician have a 33% lower healthcare costs and 19% lower odds of dying prematurely than those who only see a specialist. The U.S. could save $67 million each year if everyone used a primary care provider as their principal source of care, and for every $1 increase in primary care spending would produce $13 in savings. That adds up, my friends. That adds up. And Vermont needs to invest in getting primary care into the state. Doesn't have to be doctors. APRNs who are lower cost provide the exact same care. We need to do better. Thank you.
Yes.
Hello, my name is Jacob Berkowitz, and I live in Burlington. I've worked as a staffing specialist at UVMMC since 2020, and I serve as the Vice President of Communications for the Support Staff Union at the hospital. In my roles, I've learned much about how hospitals in Vermont operate, and what I see is troubling. Our healthcare system is on the verge of complete collapse. Our population grows older and sicker. There's a severe mental health crisis, and a lack of providers has led to wildly long wait times, especially in primary care settings. And as we know, healthcare costs have been skyrocketing. But despite the increased burden on us, Blue Cross Blue Shield of Vermont is nearly bankrupt. Tens of thousands have lost access to Medicaid and other COVID-era programs, and patients are being turned away from vital services due to a lack of insurance or being out of network, as more Vermonters are forced to choose between insurmountable debt and their health. In my union, for example, the historic wage increases we won in 2023 were partially undone when many members were kicked off of Medicaid. Many no longer have health insurance, and over 25% of my union has medical debt owed to our employer. And instead of helping to address these crises in good faith, the UVM-HN spends its energy waging war with their regulator, the Green Mountain Care Board, leaving patients and healthcare workers as collateral damage. The inpatient psych facility at CVMC is shutting down in a few weeks. Primary care clinics are being closed, forcing folks who are already waiting months to see a provider to start all over. Dialysis clinics are at risk of closure, condemning over 100 sick patients to hardship or even death if the facilities don't remain open. And as we speak, patients who should be otherwise admitted to empty beds are stuck boarding in the UVMMC ED. I won't go into detail of the UVM Health Network's decisions to comply with their budget orders or the merits of said decisions, but I urge everyone to take what my employer says with a grain of salt as they try to deflect blame. They scoff at the notion that charging patients less is an effective way to reduce revenue while maintaining some of the highest commercial rates in the nation. They claim that revenue equals patient care, and thus cutting services is the only way to reduce revenue. I wonder if they paid a PR firm to come up with that disingenuous oversimplification. And don't get me started on the irony of the CEO's nearly $500,000 bonus as the UVM-HN publicly pleads poverty. But this issue is far larger than the UVM health monopoly. The whole system is being held hostage by interests who profit off of human misery on Wall Street, in Washington, and even here in Vermont. That's why we must aggressively move toward the only solution, a single-payer healthcare system, which was the original mandate of the Green Mountain Care Board. And to those who don't stand with us in this struggle, I urge you to look to every other developed nation on the planet that figured this out 100 years ago. Thank you.
Hello, my name is Ronnie Little, and I go by they, them pronouns. I live in Burlington. I was formerly houseless for a number of years, although I am now housed.
Hi, my name is Quinn Gilbert, and I've been homeless in Burlington 3 times. I live with a disability of bipolar disorder and have struggled with addiction throughout my adult life. I'm only here today because of the grace of my community and the safety net of the society to provide a second chance to someone like me. Now we will read the National Union of the Homeless 2024 Winter Offensive Statement. During the holiday season, the National Union of the Homeless takes action together across 5 regions across the United States. In the South, Appalachia, Midwest, West, and the Northeast to declare housing and healthcare now, an end to genocide and war and the war economy, no more death on the streets both here and abroad. The Homeless Union's Winter Offensive is a series of synchronized actions and protests from Thanksgiving through Martin Luther King Jr.'s birthday, which highlights this period of time when the poor and homeless experience the most deadly conditions and highest rates of suicide and death. We work together to fulfill our mission statement that declares that we commit our lives to ending homelessness and poverty and to work tirelessly for the human right to life, liberty, and the pursuit of happiness, for social and economic justice for all.
Yes.
As our leader, Reverend Serena cries, at a time when they sing peace on earth, our land groans under the weight of injustice. And we shout, and I want to hear this back from all of you in this room today, housing and healthcare now.
Housing and healthcare now.
No more death on the streets, both here and abroad.
No more death on the streets, both here and abroad.
As we enter 2025, we are also feeling the deadly effects of the recent Supreme Court decision criminalizing the homeless by making outdoor sleeping a crime. We are seeing an increase in already deadly practice of sweeps of incarceration of our homeless and communities. We know there are 24 empty homes for every single individual in need of one, while 1,000 souls will freeze to death on the streets this year, and homelessness continues to rise at record numbers. We declare no more. The Poor People's Campaign has shown that poverty is the 4th leading cause of death in the United States. And 800 people die every day in the richest country that's ever existed in the history of the world.
Shame. Shame.
Our system is failing, and we are dying as a result of a system that puts profit over our lives. We lift up now in mourning and in honor the names of all of those that we have lost, and I call for a moment of silence. And now I ask you to join the National Union of the Homelessness and the Nonviolent Medicaid Army as we organize to unite our class across the country to end this system that profits from poverty, homelessness, and death, to create a society organized around our human rights to health, housing, and a standard of overall general welfare. You only get what you are organized to take.
Thank you to our speakers. You know what I call a system that lets people live on the streets? Shameful. A system that lets our clinics close. Shame. So when we're here to say healthcare is a human right. Say it with me. Healthcare is a human right. And housing is a human right. Housing is a human right. We're going to invite up 5 more speakers, starting with Aaron Keller, and then Christopher Medina, Kelly Hopkins, Andrew Clack, and then Jake Castro.
Hi, my name is Erin Keller. I'm a member of the Vermont Workers Center and the Nonviolent Medicaid Army. I am also a licensed clinical mental health counselor living with type 1 diabetes and several other autoimmune disorders. In the spring of 2023, I was kicked off of Medicaid. For the remainder of that year, in order to manage my illnesses, I suddenly needed to spend 1/4 of my income just towards medical maintenance through the Marketplace health insurance. I have since had the privilege of being enrolled on my partner's health insurance beginning in January of last year. Even so, the stress of losing Medicaid the year prior has had lasting impacts on my overall health that I'm still recovering from, and am only recovering from because I currently have decent coverage. However, this privilege is not guaranteed and is actively under threat. The company that my partner works for was just bought out by a new business that has made it explicitly known, literally said this to their employees, that they are going to be prioritizing profit over people. Being able to maintain my healthcare team that has helped me reach my goals should not be a question, and the reality is that it hangs in the balance like so many in our community. As a healthcare provider myself, it should be acknowledged that in order to receive care, there needs to be accessible providers, especially in a time when we are living through a mental health care crisis. I have heard from countless colleagues who will no longer be accepting health insurance due to the inhumane and reckless financial practices of these companies. Clinicians are often left in precarious financial positions, sometimes to the point of filing for bankruptcy. These insurance companies have no checks and balances and continue to degrade the dignity of providers and healthcare recipients alike. The greed of these companies undermine our ability to care for one another, and we need to make sure that they know we will no longer stand for it. Thanks.
My name is Christopher Medina and I'm autistic. I work for Green Mountain Self-Advocates. My housing is the foundation to my well-being. I live at home with my mom, but it is ridiculous to be unable to live independently as a person in my 40s. I need a place to live that is affordable, accessible, and helps me live a fulfilling life. Many people with disabilities use Medicaid funding to pay for the services we need to live in our own home. I am in need of specialized support services through Medicaid funding. I need supports to communicate my daily needs, to be effective at my job, and be healthy. Because the supports I get through Medicaid funding are often unreliable, I feel like I'm a second-class citizen. I barely get out of the house to live my life and contribute to my community. Workers with disabilities matter because we are fully human and our rights will not be compromised.
My name is Kelly Hopkins, and I'm from Bellows Falls in Windham County. My pronouns are she, her, and I'm angry. I'm here because the healthcare center in Bellows Falls, run by North Star Health, was abruptly closed on New Year's Eve with less than 90 days notice to the community, to patients like me, and to the staff. I'm here because closure of that healthcare center leaves a gaping hole in my community. A gaping hole. That one hospital court, which is the address, has been a center of healthcare access for nearly 100 years, for primary care, for emergency care, for mental health care. It was actually a hospital, a first full-service hospital on that site, prior to being run by North Star Health. My father was delivered there. My great uncle was a doctor in the Greater Falls area and worked in that hospital after returning from World War II. As a disabled person who cannot drive, I am now stranded in a healthcare desert because Josh Dufresne, the CEO of North Star Health, didn't try and didn't care to address a deficit of $800,000, which for those of you playing along at home is approximately the price of 2 houses in the Greater Falls area, one if you're living in Walpole. He used that deficit as an excuse to deny health care to an entire community. Shame. No notice, no working with the town, just no health care. We can fix this, and I challenge our legislators to do so. Our current situation is a policy choice. Do better. Let's see you work on this.
My name's Andrew Clack. I grew up here on Berlin Street. My dad worked at, there we go. Hey, now can you hear me?
Yeah.
All right, hi. My name's Andrew Clack. I grew up here on Berlin Street within view of this dome, and I used to jump the stairs on rollerblades. Now I live in White River Junction. I'm with the Vermont Workers Center. I've known very good access to health care. My dad was a butcher at the Grand Union, where Shaw's is now. That company was self-insured. I enlisted in the Navy as a corpsman at 17 years old. But nowadays, if I hadn't given the government a blank check on my life during time of war, I wouldn't have health insurance, or only via insurance I couldn't afford to use. Dental care is still out of reach. Now I'm a father and I want better for mine and all our children. A disabled veteran, I have what could be a model for every American. I gratefully receive easily accessible holistic care with little or no charge. I want all working class and working poor to have this same right. Thank you.
Hello, everyone. My name is Jay Castro, he, him, and I'm here from White River Junction and the Vermont Workers Center. And I'm lucky. During the nightmare of the COVID pandemic, I served as a frontline essential worker in Central Florida as one of the many members of the working poor who had to make do without any insurance. Watch my colleagues and my family get sick, and some of them die. And I didn't. First year I moved into New England, I learned what it felt to become homeless in the dead of winter. The panic and terror of facing sub-zero temperatures miles away from any help. The hopelessness of seeing every shelter full and every motel occupied with people just as desperate as you. But for a lucky break, I could have been thrown out on the street with not even a car to my name. I now have Green Mountain Care insurance, and I've been able to get new glasses and good health care for the first time in 5 years. And the genuine relief is palpable, that if I get sick or I get hurt, my family won't pay the bill. But these struggles aren't mine alone, and I am lucky. When my fiancée got her job working at a hospital, she got kicked off of her health care insurance for making $100 over the annual limit. And she had to quit her depression meds cold turkey. I had to hold her through her withdrawal pains. My grandfather contracted COVID at the height of the pandemic, and it led to his eventual decline and passing. I see my neighbors every day struggling with exposure and homelessness and hunger, all because housing is so absurdly expensive. All this while lawmakers and the Green Mountain Care Board say that caring for our neighbors is just something we can't afford.
Shame. Shame.
Nobody should have to drive more than 30 minutes for life-saving care. Illness should never be a gateway to poverty. We need to organize. We need to demand that health care is a human right.
Yes.
That housing is a human right.
Yes.
And we won't stop until those rights are secure.
Yes. Yes.
Thank you, Jake. Thank you, everyone who shared your story today. And thank you, everyone, for coming, filling up this room of the State House. Because we know we only get what we're organized to take. We only get what we're organized to take. Forward together. Not one step back. Forward together. Not one step back. So a reminder, we invite you again to join us in the cafeteria, grab some lunch, maybe find your legislator, let them know that you're here. We have these leaflets that reiterate our demands today. We want a public hearing on health care. We want to keep hospitals open and health centers open and expand community primary care and community services. We want to protect Medicaid from cuts and move towards health care for all.
Yes.
And on housing, we need the governor to declare a state of emergency on homelessness now, before any more life is lost. We need immediate housing for the unhoused, housing access for immigrant families, and protections for tenants, and we need them now.
That's right. Yes.
And we know when we leave today, we're going back to our communities and we're gonna keep organizing until we win our human rights. So I'm gonna invite our song leaders up to close us out with that message.
Organize, organize, organize. Organize, organize, organize. Organize, organize, organize. Organize, organize, organize. 'Cause we want health care for our people, people power and our dignity. 'Cause we want health care for our people, people power and the right to live. We gotta organize, organize, organize every night and day. Organize, organize, organize. We are here to stay. Organize, organize, organize for our families. Organize, organize, organize. 'Cause we want justice for our people, the right to housing and our dignity. 'Cause we want justice for our people, the right to housing and our dignity. We gotta organize, 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 stand up for our rights. Organize, 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 we won't give up the fight. Organize, organize, organize for our health care. Organize, organize, organize. 'Cause we want peace for our children. We want clean water and air we can breathe. 'Cause we want peace for our children. We want clean water and air we can breathe. We gotta organize, 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 stand up for our rights. Organize, organize, organize.
Good job. Good job. Good job.
Thanks for coming. Oh yeah, actually, would everyone be up? We have a couple more minutes to come up to the front here and take a big group picture together. If you're willing to be in a picture, come right up here and surround this podium.
Be in the back.
All right, and we can chant while we do it. Healthcare is a
Human right.
Healthcare is a
Human right.
Healthcare is a
Human right.
Housing is a
Human right.
Housing is a
Human right.
Housing is a
Human right.
Healthcare is a
Human right.
Healthcare is a
Human right.
Woo! Not one step back.
Not one step back.
Forward together.
Not one step back.
Beautiful.
Not one step back.
Well, some of us might have to take a few steps back, actually, to make it.
All right.
We're going to squeeze you.
Yeah. Come squeeze in. We've got room. Come on.
There's room in the center. Step to the center.
There's a card right there.
Okay, thank you.
Hold up your signs.
You can't see the camera can't see you.
Which camera?